The 2014 World Cancer Day identified 4 myths. We don't need to talk about cancer. There are no signs or symptoms of cancer. There's nothing I can do about cancer and no right to cancer care as responsible for the increasing rates of cancer cases. This is specialist in breast cancer, Dr. Rollins Jamabo, and a laboratory scientist, Chris Mbata, say dispelling damaging myths and misconceptions about cancer requires regular checks.
Cervix, who is bleeding, and she just thinks it's just mere blood, a bad blood coming out of her. And she forgets that it's an abnormal bleeding and will not see a doctor. That is a myth among our people. And that of the prostate, the same thing. So, to debunk this, we need to have routine cancer screening.
Men from 40 years, they start to have this cancer of the prostate. So the only way is advocacy, just as you are doing. Go on air, talk on air, let people know, so that regularly they go for check. Once they go for check, if it is diagnosed early enough, it can be treated, and especially when it is a benign case.
Dr. Jamabo is also appealing to government to subsidize cancer treatment as its economic burden is enormous.
In Britain, for example, all cancer treatment is free. Like all endocrine diseases like thyroid and such diseases are free. So government needs to subsidize this because of these drugs and assist us, because we are very poor here. And then most people really die off because there's no money to pay for these drugs.
They are of the view that reducing stigma and dispelling myths about cancer also require raising collective advocacy in improving general knowledge about the disease. Nengi, Fine Country, AIT News, Port Harcourt.